So, as a woman in my 40s, I'm 43 years old.
Stop.
Yes, I've
Okay.
already passed the fourth decade of life.
Okay.
I know that menopause is on the horizon somewhere, and I'd like to know what are some things that I should be looking for once I enter perimenopause. I don't think I'm there yet, although my period is irregular, but it has been for quite some time, so that's nothing new per se.
Okay.
So I just want to know what I should be looking for and how I can mitigate.
Right. Navigate, mitigate. Right,
Yes,
right.
the
Right.
symptoms of menopause, because I've heard that it's not very pretty.
You know what? Let's first, tell me more about your periods. You said that it's always irregular. What's the pattern of it?
They've been irregular, I would say, for the last 7.5 years. I've also been chronically ill, so that's probably at play. But I say I haven't had a period now. Let's see, this is March, so probably about 4 or 5 months at this point.
So 4 or 5 months, no period.
Right.
Are you on certain medications, like hormones, that would stop your periods?
No, I do take thyroid replacement because I had a total thyroidectomy when I was 28, 29 actually.
Okay.
But outside of that, I'm not on birth control. I don't have an IUD or anything like that.
Having no periods and not actually being on any medication, that could put you at risk of developing abnormal cells in your uterus. So, I mean, that's the first step that I would want to kind of see lab work, do a hormone panel for you. And that's probably like the first step when women come and say, you know what, Dr. Kendra, I don't have any periods and you're not in your 50s,
Right.
we order a hormone panel so then we could see how close you are. Is perimenopause here? Are you close to menopause? So I think that will be our first step,
Okay.
is to do hormone testing.
Okay.
And then from there, depending on those results, then I would consult to either get an IUD or some type of birth control, oral birth control, if you're not menopausal.
Okay.
Okay. And then do an ultrasound, because 4 or 5 months, and this is like a long period, over several years,
Right.
then I'm interested in getting an image of your uterus so I can look at the endometrial lining.
Okay.
Okay. But you know what? Perimenopause, studies say that it starts at 40. Okay. So what is it? An occasional hot flash that you'll get every now and then, agitation, irritability. And the thing about perimenopause is that sometimes women can get their periods more often.
Oh,
And then
boy.
you're thinking, wait a minute, I just didn't start my cycle. Like, is this like back when I was 11 and 10
Right.
and I'm just starting and it's coming back heavy? So that was the first sign. When you start having your periods coming closer together, that's the first phase of perimenopause.
Oh, boo.
Yeah. And then it starts spacing out. And in the middle of all that, you may experience vaginal dryness. So you would say, hey, do you have a partner right now?
I don't right now.
Right. Okay. So,
But I do want one. So.
Right. So don't be surprised that you may experience painful intercourse because of the vaginal dryness.
Okay.
Because as we age and we're going through perimenopause, our estrogen levels are decreasing. And
Right.
so a lot of us, especially a lot of us in our community, we don't seek help to treat those symptoms. We just
Right.
think, you know what, we have to live with it. It's a
Right.
part of life. But I'm here to tell you, no.
Not anymore, huh?
Right. You don't have to live with that. And that's when you would book a consultation with me, askdrkendra.com, and we would go through just what I mentioned, but we would have more of a plan of how we're going to address the issues. But the first and foremost is for me to do a hormone panel, because we want to see where you're
What's actually
at.
going on. Okay.
Right.